Go live isn't the finish, but the starting point. The right approach turns users into lifelong champions, not just customers. Let's talk about how to embed them early, keep them engaged and optimized so they never want to leave. Stay tuned for how CliniComp make this happen. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Rombach, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability.
We all know when we start leveraging technology, sometimes the resistance has been, well, you're taking human out of this. How would anybody have a good customer experience? And that's why we have Sandra Johnson here with us from CliniComp. It's not just about leveraging technology. It's actually about integrating and use it to boost how we engage, how we talk, and how the entire workflow is making more ease. And as many of you know, I'm a big proponent and promoter of sustainability and resilience. So all of these resources that we have on our fingertips are truly how we're leveraging the right resource and the right platform to help us. It's also now about boiling the ocean, try to do too much or trying every single technology. Find out what works and let's get going. So excited, Sandra, you're here joining us with all of your years amazing experience in this particular field. Tell us a little bit more about you and your background and how did you land in this particular company and position out of anything else that you can do in the world?
Absolutely. Well, first off, thanks for having me. This is such a great opportunity to have this dialogue today. So thank you. I'm the Senior Vice President of Client Services at CliniComp, and I've actually been in the healthcare IT space for over 2 decades now. I originally started out in the consulting environment. When I graduated from college, I was excited to get exposure to multiple industries and engagements and thought that would be a perfect avenue and venue for me to get to explore what really I was going to be passionate about. And so through those opportunities, I was able to get aligned with some large scale implementations in the healthcare setting. And that's when I really identified my passion for bringing strategy and operations mixed with the technology to improve patient care. So that's how my career has evolved. And I helped implement the CliniComp system with some customers prior to joining the organization. So I have both perspectives now that I'm on the team at CliniComp. And so I have the customers' desires and needs front and center. And I think that really helps us provide exemplary customer support to our user base. And we always just want to make sure that we're evolving our technology to meet the demands and real-time needs of the clinicians. So that is what's most important, to make sure we're serving their needs.
Exactly. I believe any business has these critical pillars, and then we say there are 12 of them. And one of the major pillars is that customer satisfaction retention side, because most businesses spend a lot of time and money on acquiring these potentially leads, right? These potential clients. And we wanted to make sure all of that effort get maintained through the best relationship, workflow, and easeability, making sure that the tools and resources and services doesn't seem like the extra add-on, feel like it's a burden, but it's so supported, they're getting even more out of what they even thought of. And then they can become our champions, right? Start really talking up, telling all of their colleagues. So then the business truly expand in that warm and organic growth. So tell us more about what did you guys do so well, in particularly in CliniComp, that perhaps other people haven't thought about it, and to really help with the process of retaining all of these relationships for clinicians and helping them to become your champions.
Yeah, at CliniComp, we have a unique delivery model. It's called System as a Service. So you're not just getting a product, but all of the support services that are required to implement maintain, and then optimize that product over time. So we really want to ensure that as you go live with our system, that is just the beginning. And we want to continue to partner with you and evolve the product to meet your needs. And it's scalable to evolve as your organization grows over time. So we really take a partnership approach where we're providing the hardware, software, and services that you need. And so we're really focused on listening to the voice of our customers. We put the clinicians front and center, and that's even in our development lifecycle. We have clinicians embedded in our organization within every department, so that as we're designing, developing, and implementing the product, that real life use case is always front and center, and we're trying to solve their challenges. And then providing that peer-to-peer support. So we have clinicians training clinicians and focused on their workflows and how to optimize their workflows. What can be the time-saving measures? How can we automate their workflows so that we're really giving them more high-value time to spend with patients instead of the system itself? And so really taking that collaborative partnership approach where we're providing the resources to just be an extension of the team and take the heavy lifting off of both IT and clinical to manage the system over time is what that system as a service model is about. We want to make sure that you have all the resources when you need it, readily available with no obstacles to prevent you from optimizing the use of the system.
It's so critical in having the users in the beginning phase of creation. I think most of the time when we think about accessibility and adoption, why it's so hard is that sometimes we didn't, just like you guys, you have clinicians in every single department, every phase. So they have the early on to test things out as you're innovating, creating, and optimizing, and also making sure the things that has been doing super well and keep it. When people are not having their end users in their product creation phase, and that's where we see the discrepancy of how come the innovators, right, the scientists behind the genius already create a path, but people are not seeing it. And it's because the language of how they see it, what they talk about it, even you might be saying all the same thing, they're not hearing or not seeing. So having those critical people in every single department that you're doing and creation, I think is very important and something nicely presented by you guys. Tell us more about the technology. Actually, what do you guys are able to help to solve for the clinicians across the board?
Yeah. Well, I think in the EHR space, interoperability is one of the largest challenges. And because of our underlying architecture, we have a scalable platform that can plug and play with other systems and normalize data across disparate systems so that it can still serve up data in meaningful ways to create actionable information for the clinicians to have informed decision-making capabilities. So having that scalable platform that can interface with other systems or provide an end-to-end solution so that you have, access to all of the information to have a holistic view of the patient and really make informed decisions is a key differentiator. We have been able to evolve our product over time. We were a modular system and then inpatient and now offer the full EHR solution suite. So it's unique that we have a fully integrated PAC solution with our EHR. We have launched intrinsic AI, which is embedded in the core architecture of the system. So clinicians are really able to leverage the automated workflows across the entire healthcare ecosystem. And so really, again, focusing on ways to improve the clinician's workflow, automation, and streamlining workflows to really add high value interactions with the patient is what we're focused on doing.
Now tell us more about when you think about interoperability. Many people know it's when you are going to different systems. Some hospital system, even their outpatient uses a different EHR than the inpatient uses a different EHR. Sometimes you can't see all the notes across the board, and versus some private practice have their own little domains of what the EHR is versus long-term care. So when your patient is going from a long-term care back to the hospital or emergency room, or when people needed to be discharged back home, I would love for you to talk about what are some of the user cases and platforms that you are already being connected and how is that being used right now?
Yeah. So Being that our start was in the inpatient setting, our strength is integration. So a lot of our initial customers were using us in the inpatient arena, and then something else in the ambulatory setting. So our platform is able to bring the data from the ambulatory setting into our system and present that in meaningful ways so that you truly have the longitudinal patient record to look at and see, all of their outpatient encounters and how that impacts where they are in their care delivery right now. And so really being able to pull that data into one view so that you have informed decision-making as you're continuing the treatment plan is really important. So our platform has the ability to integrate with other systems. It's also an end-to-end platform so that there is that continuity across clinical settings and the continuum of care. But that is our strength, and being able to work with whatever a healthcare system has and making sure that we're bringing in all the data so that you have a holistic view of the patient.
Does that mean, tell us some of the hospital system or ambulatory care that you're working with, where are they located? And are you guys more working as the connector in the platform and not just your own EHR system that you're connecting to, let's say, Epic, Meditech, and all different places where people have data and able to synchronize and also distribute? How does that work?
We work with some of the large EHR vendors, Epic and Cerner. A lot of our commercial customers early on were using our perinatal solution. As I mentioned, we started out as a modular system. And so perinatal and critical care were our primary focus as their data-rich and intensive environments. And we offer medical device integration with our solution suite. And so we're able to connect to all the devices at bedside and pull those parameters and waveforms in and provide the central monitoring. And so we have a lot of commercial customers that use us in the perinatal setting and might be using one of the other large EHR vendors. And so we connect and have a fully integrated solution so that they have all of the necessary information in our system or transported to their other EHR. We also have organizations that use us as the inpatient solution, and we are the platform to connect to the other systems. And then we've been expanding into have the full end-to-end solution so that you have a connected ecosystem between the inpatient, ambulatory, and ancillary settings. So we have customers across the globe. We've supported the US as well as internationally.
Amazing. I know every single technology company, we're all constantly wanting to grow and scale and make an even bigger impact because we see the work that's already being done, proven, and people love it. So I always like to end with a fun question. Now, if I give you a magic wand and the magic wand grant you 3 wishes to make this even bigger impact within the next 6 months, what would you use the magic wand for?
I would love to have a magic wand for many reasons. But I think I would use that magic wand just to share with the industry at large that there are alternatives out there. You mentioned scalability. And so having a solution that can scale to meet your needs now and over time is very important. And so whether you're a large enterprise system or a specialty hospital, we have a platform that adapts to your workflow and not the other way around. So just knowing that there are options out there that can be customized and tailored to your specific needs at providing a lower total cost of ownership with all of those support services is really critical. And just making sure that you have visibility to all the options that are out there so you can get exactly what it is that you need.
Awesome. So what I'm hearing is all your 3 wishes is really one is become making yourself more aware to the public. And then it's not just all public, it's this organization who hasn't quite adapted interoperability in particularly it might be critical care and perinatal, that areas that you guys are already been focusing on to see how do we create better workflow, better data point analysis to help the faster and higher quality of decision making with the clinical staff. Is that correct?
Yes, absolutely. I think, healthcare leaders today need more than just data. They have to have the clarity, the efficiency, and the partners that they can trust. And so, at CliniComp, we provide systems that are built to last and scale and evolve with you. So we're happy.
I am so excited for us to have this conversation. And for anybody who's watching, listening, drop your comments below, or take a screenshot, post that on LinkedIn. We would love to hear from you. How are you able to leverage interoperability? Or is this something that you are considering adapting? Perhaps you have some fracture of that existing, but how do you want to optimize even more? We would love to become the solution to your concerns and challenges, and definitely reaching out to Sandra and CliniComp when you guys are at the level of truly creating the synchronization of all platform and data analysis for the most amazing work that you guys already been doing with your patients. And now let's take to the next level. Until next time, thank you.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.